When we're talking about safety measures, those can apply to patients, the products that we're making, but also to our staff. So let's talk about those for a minute. When we are talking to a patient for the very first time, we want to make sure that we are gathering a lot of information about their health and their background, as well as their current medications. Because even if we're preparing a cream, sometimes that cream is going to be absorbed through the body. We don't want drug interactions whatsoever. But from there, we have very specific pharmacy software that we use to put in formulas. Those formulas are cross-checked. Not only that, but it is cross-checked with the barcodes associated with the active and the inactive ingredients. Because let's face it, a lot of drug names look an awful lot alike and they sound a lot alike. So we don't want to grab the wrong thing. So by using a barcode measure and scanning that with every single item on that formula every single time, that ensures that we are picking the right products to go into that preparation. We also make sure that we have got the right kind of paint on the walls, the right kind of flooring on the floor, even the right kind of countertops. We want to make sure that if we're making a preparation that has issues with metals, that we're using a very specific type of epoxy or plastic spatula. That is key because we don't want medications to change color or smell or even expire before they're supposed to. From that, we also make sure that we've got the best personal protective equipment for each and every staff member. So what does that mean? We're talking about head covering, eye covering, gowns. Are they the right type of material? Is it impervious to certain liquids? We want to make sure that we've got the right kind of gloves. Not all gloves are created equal. We want to make sure those chemicals don't go through that glove material and land on our employees' skin. We also use shoe covering. We don't wear our garb outside of the lab. We don't want to cross-contaminate wherever those particles may be floating around. We don't want to share that with any other preparation, and we don't want to share that with any other staff member. We have a several point check with our software to evaluate that the formula that was chosen for that prescription is the right one, but it's also the right one that's coming out of the lab. We also have document proof where at any point in time, we can look at the original prescription and compare it side by side with what we have in our hand. So all of these measures are very important. Of course, there's more. There's so much more. But those are just a few as to what we have taken on board here at Makers Compounding Pharmacy, because we want to do the right thing every time, because it's the right thing to do.